Joffe Medi-Center. Imagine you. Joffe Medi-Center uniquely brings medicine to spa and spa to medicine in order to provide an expanded range of services with the goal of creating a lifetime relationship of care with you. Joffe Medi-Center is the namesake of its founders, Dr. Stephen Joffe and his son, Craig Joffe. Dr. Joffe has been a pioneer in multi-specialty laser surgery centers with over 30 years of experience, having built one of the industry's leading publicly traded laser vision correction providers at the time of his retirement in 2006. As a family-owned company, Joffe Medi-Center is dedicated to giving back to the community, as well as providing mission help to developing countries. The Joffe Better Sight Foundation was established in 2005 with a mission to provide laser vision correction and related services to patients who could not otherwise afford to pay for such life-changing procedures. At the Joffe Medi-Center, we are personally committed to ensuring that your treatment, the service you receive, and your overall experience creates a lifetime relationship of care. Joffe Medi-Center. Imagine you. Dr. Kenneth Smith. Dr. Kenneth Smith is a board-certified ophthalmologist and medical director of Joffe Medi-Center in Louisville, where he performs laser vision correction as well as aesthetic procedures, including Botox injections. Dr. Smith is a diplomat of the American Academy of Ophthalmology and a member of the International Society of Refractive Surgeons. Dr. Smith has performed thousands of refractive procedures since 1999 and is passionate about this specialized field because of its ability to improve the quality and convenience of life for so many. Dr. Smith has lived in the Louisville area with his family for over 15 years. He has dedicated a significant amount of his career to laser vision correction. Joffe Medi-Center. Imagine you.
Hello, I'm Dr. Kenneth Smith, board-certified ophthalmologist and medical director for Joffe Medi-Center. Thank you for visiting us today. I chose to partner with Joffe Medi-Center for many reasons. With no emphasis on quotas and quarterly shareholder reports, there's a genuine approach to providing you the best value and the best quality of care in the marketplace. I'm excited to work with Dr. Stephen Joffe, as the name Joffe is renowned in the field of LASIK eye surgery and for the developments of medical lasers for over 30 years.
How do I know if laser vision correction is right for me?
The extensive testing you're receiving today, the multiple prescription checks by your technician and doctor, orb scan and wave printings, corneal thickness measurements, pupil measurements, and dilated health exam will provide us the medical information we need to confidently recommend laser vision correction for you. But the medical testing is not the only factor. Just as important is the discussion we will have with you regarding your expectations and reasons for considering laser vision correction. Since no two eyes or clients are the same, a unique treatment plan will be designed according to your specific needs.
What does LASIK mean?
LASIK is a procedure that shapes the cornea from within using a laser. In order for the eye to focus light clearly on the retina, the cornea must be of the proper curvature. If it is not, nearsightedness, farsightedness, or astigmatism is present.
What is nearsightedness?
When the cornea has too steep a curve or the eye is too long in relation to its corneal curvature, images focus in front of the retina instead of on it. That's nearsightedness, and the result is that you can see objects up close, but the distance vision is blurry.
What is farsightedness?
Farsightedness occurs when the cornea is too flat or the eye is too short. This causes images to focus at a point beyond the retina. If you're farsighted, you have difficulty seeing objects both up close and at a distance.
What is astigmatism?
If the cornea is shaped like a football, more curved along one direction compared to the other, then images bend in such a way as to create no single point of focus. This is called regular astigmatism, and it results in blurry and often distorted vision.
What happens during the LASIK procedure?
First, an instrument is used to fashion a thin protective flap from the outer corneal layers, which is painlessly lifted. The cool pulses of ultraviolet light from the laser are then computer-guided to precisely and smoothly sculpt the cornea's inner surface. You'll hear a steady clicking sound as the laser is operating. You are also likely to notice a mildly acrid smell. I have full control of the laser and can turn it off at any time. After the laser, which typically takes from 10 to 60 seconds, the corneal flap is repositioned and self-adheres. Because of this bonding quality, no stitches are needed. When the cornea is reshaped, it focuses light directly on the retina to provide clearer vision than before. If treating nearsightedness, the laser removes tissue from the center of the cornea, making it flatter and reducing the focusing power. This moves the point of focus from in front of the retina back to the retina. If treating farsightedness, the cornea is made steeper as the laser removes tissue from the periphery of the cornea. This helps the cornea bend light more and moves the point of focus from somewhere behind the retina back to the retina. If treating regular astigmatism, the laser removes tissue from the flatter meridian, thereby making the cornea more spherical or round. This allows light images to come to one point of focus on the retina.
What is the difference between LASIK and PRK?
PRK is a form of laser vision correction called photorefractive keratectomy. Unlike LASIK, PRK doesn't create a corneal flap. Instead, the top epithelial surface of the cornea is removed and the laser precisely reshapes the curvature of the eye, just as in LASIK. PRK is typically recommended for patients who have thinner than average corneas or shape variations that make it safer to not cut a corneal flap.
What is custom wavefront guided LASIK?